Grinding teeth makes headache. Do not grind your teeth to stay bite resistant. At least not at night. Many people grind their teeth in their sleep. That is not good for the teeth and certainly not for the desired recovery. According to the Federal Dental Association, at least 1 in 3 adults grinds their teeth or presses them tightly together while sleeping. For most of them, bruxism, the technical term for this increasingly common functional disorder, begins between the ages of 30 and 45, but there are also grinders from an early age. Head and backache are the consequence. The pressure with which the jaws are rubbed or pressed together for up to 2 hours is many times greater than when chewing. Possible consequences include grinding facets on the chewing surfaces, in extreme cases teeth rubbed down to the roots, cracks in the tooth enamel, painful indurations and tension pains in the masticatory muscles, inflamed jaw joints, dizziness and tense neck muscles. Often, stress is to blame. Sometimes the trigger is a new filling, crown or bridge and the body automatically tries to grind away the disruptive factor in the mouth. Most of the time, however, stress is the trigger. That is why bruxism affects more and more people who are challenged as high performers in work and family. First aid for grinders: a plastic relief splint, individually adapted by the dentist, which is worn at night, protects against further tooth damage and relieves the masticatory muscles. Self-massages, physiotherapy or acupuncture bring also good results. Results of a study running at the university show that acupuncture works very well with patients. In the case of chronic pain, an orthopedic surgeon or pain therapist should definitely be consulted. A central part of bruxism therapy is learning relaxation techniques to reduce stress. Everyone has to find out for themselves what is good for them: progressive muscle relaxation, autogenic training, yoga or tai chi. For some, endurance sports such as walking or jogging also help. Bruxism can only rarely be treated completely away. Therefore, the reconstruction of sanded tooth substance is only useful if the patient is first pre-treated and then closely followed up, warn experts. Long-term prevention: once you have started crunching or pressing, you do it again and again. Namely when life becomes uncomfortable. Therefore, wear the bite splint prophylactically in times of stress, continue with relaxation training after the actual treatment, and observe yourself regularly. How do I hold teeth and jaws? What is correct is the so-called floating rest, in which there is a distance of 2 to 3 millimeters between the upper and lower jaw. Tip: attach a small sticker to the computer or in the car as a reminder. If you catch yourself clenching your teeth, it's time to relax. Self-check: do you secretly grind? If you answered yes to at least one of the following questions, this could indicate bruxism, and you should speak to your dentist. Feel your muscles on the cheek towards the jaw joint and in the temple area. Is it tense? Have small hardenings formed? When you first yawn in the morning, do you have sore muscles in the jaw joint or in the masseter muscles? Do you have an unexplained headache or facial pain? Does your partner feel bothered by grinding noises at night? Do you feel or see bite marks on the edge of the tongue or on the inside of the cheek? Then you are probably a grinder and should see your dentist.